Workers who have yet to be vaccinated against COVID-19 could soon be paying as much as $50 more per paycheck for health insurance. This as companies across the United States are trying to protect their employees and themselves from outbreaks of the disease. Paul Seegert, managing partner at PCS Advisers, joins us from Nashville this morning. Good morning.
Good morning. Thanks for having me.
So were you surprised when you started hearing that there's some momentum gaining behind industry professionals who are saying, listen, unvaccinated people are going to start paying more money for their insurance?
Not entirely. There is some precedent for this. If you are a higher risk to the health plan and could add higher cost, we have seen that in the past with smokers. There's surcharges for smokers on certain health plans. And a stay in the hospital for COVID could be as costly as $50,000 if you have a complicated case. So there is some logic to employers doing this, and I think they might prefer it over mandating and requiring the vaccine itself.
It's like any personal decision you make when it comes to insurance. You make a personal decision, has financial consequences, right?
Exactly. Yeah.
I think one of the interesting things, though, you're going to get some, from the other side of it, people are going to go, well, if you haven't gotten the flu shot, does your insurance go up? So why?
Right.
There's going to be always that question, right?
Yeah, there's that slippery slope. Where does it stop? And there are some lawsuits that we are watching where employees who've gained natural immunity are suing their employer over the vaccine mandate because their contention is they have protection, and that they would not necessarily gain greater protection by getting the vaccine, and so they'd like to have the choice not to get the vaccine.
Now, we have seen companies incentivizing people to get vaccinated, giving time off to be able to go in and get the vaccine. Do you think this is maybe just another way that companies are just, trying to make sure that their employees get vaccinated?
Yeah, they're trying to apply some pressure. I think now we're at the point where those that were going to respond to positive incentives have already done so. So employers are now at the point where if they are going to push harder, it's likely to be a little bit with the stick as opposed to the carrot.
And you said it could cost exactly how much per person if they were to be hospitalized for COVID? What's the average cost there?
We see claims as high as $50,000 for a hospital stay related to COVID.
Wow.
And not a small expense to a health plan.
No, especially when you have a lot of employees as well that are working for you. If people have more questions and they want to find out more, where can they go?
Well, you can certainly visit our site. It's PCSadvisers.com with an ERS, and we're happy to help any way that we can.
All right. Thank you, Paul Seegert, for joining us today and keeping us updated. We appreciate it.